This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live. Her main goal is to make an impact in patients' disease, prevention, and health optimization.
Once you open the door of lifestyle medicine, then you start seeing other problems in a different way. You start looking at chronic disease in a different way, especially patients are quite sick and they might not be as sick if you don't dive into some tests, laboratories, microbiome testing, either oral or gut functional testing, etc. We have a population that is very heavy in the US. And then we have a lot of cardiovascular disease, we have a lot of cancer, we have a lot of this, a lot of that. They fit together, actually. At some point, I just figured that it has to be something for the mouth similar to what I'm doing with the gut. Let me go and find out.
Yeah.
The dental history is not part of the regular clinical history. You go through review of systems and this head, ears, nose, and throat, and nose and throat. It's in the back. And there's nothing here.
I have never honestly thought about the fact, like, in dentistry, we ask for a medical history form. But you guys, yeah, it's not even asked.
And maybe now that there's a little bit more awareness that there might be some bacteria in your mouth, there might be something going on over there that might be related to Alzheimer's disease or any cognitive problems and heart disease and immunologic problems, autoimmune disorders. And tell the truth, when a few years ago, when finally the Medical Association decided to call obesity a chronic disease, it was revolutionary. It was a huge fight in the medical community, and for many different reasons. We still wanted to keep the blame on the patient.
We are so uniquely set up in dental hygiene to be so much more valuable than what the box that we're put into can provide. It's all one tube, like it's all connected. So why can we not have that collaboration with functional providers in our communities to be able to really reach, okay, why is this patient getting the ulcers? Why is this patient having that uncontrolled periodontal disease? Hey, maybe we should be talking about a dental intake form at your medical provider's office.
If you give the patients the power of understanding their pathology, they own it. Now they can rationalize it and make the changes. You tell people to do 15 things, you'll get 3. So focus on those 3. With those 3 things that the patient might be doing, they're 10 times better than what they were when I found them.
But let's just be real. The majority of dentists aren't looking at that, especially outside of the biological space. Dentists aren't looking at that because I'm not going to say because, that's just not what they're trained to think.
All of them had periodontal disease. All of them.
Mm-hmm.
That's severe periodontal disease. Patients fight you on the sleep study. They don't want to get it done. I'll lose the weight and I won't have it anymore. Yeah, but if you have it and I'm not treating it, it makes it so much harder to improve.
It's amazing what happens when we can breathe.
Yes.
And upper airway resistance, where you don't have all of those stops, but we still aren't breathing properly, has a profound impact on your health.
I just am stepping away from this conversation with the fact that now all doctors should be doing a dental questionnaire.
Yeah.
Have you been diagnosed with periodontal disease? Do you have sleep airway issues? Has a dental hygienist ever told you your gums bleed easy?
If a patient comes to a primary care physician with obesity, with a BMI of above X, the patient needs to be referred. The patient will not be treated, even though it's like the diet, a couple pills, maybe GLP-1. No, it needs to be referred to a specialist.
The test kind of points you in the direction of, okay, we've got X, Y, and Z going on. These bacteria are tied to cognitive function issues, Alzheimer's disease, cardiovascular, diabetes complications.
I do see the dentist office with something like a nurse practitioner in there that just does clinical care. But a lot of functional medicine is not being ignored anymore and taking matters into their own hands and making more progress. And then they push the medical community.